This video is about stress and the gut-brain axis. I talk a lot about the gut-brain axis because it's absolutely paramount that you understand the connection when it comes to healing from your condition. The gut and the brain are highly regulated and strongly tied to one another. And there's a bidirectional communication between the gut and the brain back to the gut. So understanding this will help you when it comes to putting together some therapies and healing from IC. Little disclaimer here. It's important to root out and resolve any source of inflammation in the body, including gut infections, food intolerances, and chronic viral infections and bacterial infections. Following recommendations won't improve your condition without resolving the source of inflammation. Contents of this presentation are for informational purposes only and are not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician and other healthcare provider with any questions you may have regarding a medical condition. So, there's emerging evidence that links our gut microbiome and the central nervous system as regarded as a paradigm shift in neuroscience. So that is really important because there's implications that arise from this shift in neuroscience that can help understand stress-related disorders, whether they're stress-related psychological disorders or stress-related physiological disorders, as the one we're dealing with. So that this evidence can suggest that the gut microbiome can actually modulate brain function, development, and behavior through this immune, endocrine, which is your hormones, and neural, which is the brain, pathways known as the brain-gut microbiota axis. So that's what it's called. These pathways are the gut-brain microbiota axis is basically connecting the immune, the endocrine, and the neural pathways of your body. So the gut microbiota can actually modulate brain development, brain function, and behavior. And knowing this and understanding this is going to help you tremendously as you move forward with healing. Differences exist between the microbiota. Whenever I say microbiota, I'm talking about the bacteria in your gut, okay? 90% of the time, that's what I'm referring to. Although your bladder has a microbiome, most of the time I'm talking about the gut because that's the one that does all the work and all the signaling and all the digestion and immune modulatory stuff. So differences exist between the microbiota and the composition between the lumen of the gut, which lies close to the proximity of your mucus layer. So, for example, there's gram-negative proteobacteria and Akkermansia muciniphila, which I've talked about in other lectures, that use mucus as a carbon and nitrogen source. And they basically stick within that mucus layer. That's kind of where they hang out. But this gradient or the amount that they consist of in different parts of the gut will be regulated by various factors, and that includes stress. So there's different phyla of bacteria, and you may have seen some of these in some of your lab testing. So if you've done a stool test, or even a urine test, you may have seen things like Enterococcus or Lactobacillus clostridium. That's in the Firmicutes phyla. And then there's Bacteroides, which is the one we love because it tends to be more anti-inflammatory. So you see Bacteroides high, and that's usually indicative of maybe you probably eat a plant-based diet. People with plant-based diet tend to have more Bacteroides. Then there's the Bifido strains, E. coli, which is a form of Proteobacter, gram-negative, Fusobacteria, which is that Akkermansia muciniphila, and then Cyanobacteria. So there's all different types of phyla. And there's so many more that we're just starting to uncover. We don't know it all. We're still learning. And scientists are still learning. So the main function of the intestine is to regulate absorption of nutrients, electrolytes, and water from the lumen into the circulation. And it also is there to prevent the entry of pathogens like bacteria and yeast from entering through the lumen into your system. It also regulates the exchange of molecules between the environment and the host, which is you, and influences the equilibrium between tolerance and immunity. So that basically your ability to distinguish between self and non-self. So being able to tolerate foreigners that get in. So it has like a little army of its own that's kind of like regulating all that. So obviously you see that process is broken, you're going to have a lot of problems. Now, what's really, really drawing a lot of attention is the mucus layer consists of secretory IgA, SIGA, we call it. And it's really a very important immunoglobulin, but it's also an antimicrobial peptide. So it has antimicrobial functions that covers the lining, the epithelial lining here of the GI tract, and it can facilitate, transport of materials through here, but also it can act as a protective barrier against bacteria from invading. So you can imagine like the secretory IgA, we're going to call him Soldier Siga, or, yeah, let's call him, he's a soldier. I was going to say, is he a captain or is he a sergeant? Maybe he's a sergeant. We'll call him Sergeant Sika. He sits over here and they kind of regulate what's going to go in and out. And so he's really there to protect you. So if you look at your GI map and you notice that your SIGA is down or it's on the lower end of the range, that's saying that your gut immunity is weak and it's allowing things to get in that shouldn't be there. And we have to raise that. So how do we do that? Many ways. So there's an inner and outer layer within the gut, and they just have all these, proteins and protein-mediated mucins, and so they're all there to maintain and renew the mucus layer, and that happens every hour. Disruptions in this barrier can have pretty serious implications for functioning. So you hear a lot about tight junctions. So I'm going to get a little science geeky on you here. So tight junctions are really the little junctions and these little layers of your cell on your gut. So see these little fingers, those finger light projections. There's little cells that are supposed to be, no, these are not what I'm talking about. I'm talking about here. The tight junctions are in between the cells. These finger light projections are your microvilli. These are important too, and they're often blunted in celiac. But right now we're not talking about celiac. We're just talking about the in between these two cells, because you can see this is your gut lining and you really don't want things to pass in. Everything should be passing in through this layer right here, through the microvilli. But what happens is these get broken and they're kind of leaky, so to say, and because the proteins that connect these, there are these, mainly the three that we talk about most are these three proteins, claudin, occludin, and triculin. I do not know how to pronounce them. I just see them in a lot of literature. They are transmembrane proteins. See, they're right here, and they regulate, this differential space between these two, the cells. And they can create a mechanical link between the cells and establish a barrier. And they can basically regulate fluid and things from getting in and out. There's other things that are going on that I'm not going to get into, like iron RNAs and microRNAs and things like that are involved in the immune system. But there are a lot of structural similarities between your gut cells, placental, and also your blood-brain barrier. So that's why when we say you have a leaky gut, you can also have a leaky brain, because the tight junctions can also seal the endothelial cells of the brain. So these kind of cells also exist in your brain, and they can get leaky, and that can cause a lot of problems. Microbiota, which is your bacteria in your gut, can basically regulate and modulate this tight junction in your gut, but also the blood-brain barrier. Short chain fatty acids, which if you don't remember what that was, you got to go back to my short chain fatty acid video. They help produce the good strains of bacteria that can normalize the permeability of the blood-brain barrier. So what I'm saying is, if you suspect you have a leaky brain, which could be stemming from a leaky gut, you got to get the gut bacteria where it needs to be. You got to get that butyrate up. You got to get those good species of bacteria, the lactobacillus and the bacteroides, to good levels. You got to reduce the pathogens and the Klebsiellas, the citrobacters, and the streptococcuses in order to get things to be back to normal. So they're highly connected, the gut and the brain. So this figure kind of shows you what can happen if your gut-brain intestinal barrier is disrupted. You can have some pretty serious neuropsychiatric consequences of a dysregulated intestinal barrier. And the activation of brain-gut microbiota signaling pathways via compromised intestinal barriers can affect your mood, anxiety, cognition, and social interaction, excuse me. So you can have impaired social function, cognitive function, anxiety, and depression. So if that sounds like you and you have gut problems and you have bladder problems, you probably have a leaky brain. So the brain-gut microbiota axis is a bidirectional signaling between the gut and the brain. It is evident that the gut microbiota is required for normal development of the hypothalamic pituitary axis, which we call the HPA axis, which we talk a lot about with stress. And there's a certain period in your early life that the colonization has to occur to ensure normal development of this stress signaling pathway. So a lot of times this thing gets disrupted from the time that we're born. And that's because, depending on how we're born, if we're C-section, or if we're vaginal, and if we've been breastfed or formula fed, and the amount of stress your mother may have had pregnant with you and after labor, and there's so much involved in it, but it all does start from your childhood. There's also the hygiene hypothesis that says that less microbiota diversity may contribute to increased risk in chronic inflammatory disorder and depression. And that is evidenced by people who, as a child, may have taken a lot of antibiotics. So if you have a history of taking a lot of antibiotics, you might have been affected by this hygiene hypothesis, which means that you've reduced the diversity of bacteria in your gut. And as a result of that, it's contributing to some of your neuro issues. There's also aging that's involved in this. That's called inflammaging. And that's over time, especially after menopause. There's changes in these inflammatory cytokines, and there's increased levels of TNF alpha, which is a pro-inflammatory cytokine, and IL-6, another pro-inflammatory cytokine, and C-reactive protein, which is something that you can measure inflammation, and they can also affect mood and cognition. So if you're high in these inflammatory markers, you also may have issues with your mood. Composition of the gut during aging plays a very important role in the activation of the immune system. So inflammaging can also impact leaky gut. And differences in your microbiota are more pronounced in elderly subjects. So we've seen studies where people who were elderly had more pronounced differences in their microbiota, and that was also measured through inflammation. So the slide says much of this is established in early life, and a disruption can predispose you to stress-related disorder. So depending on your history, which we reviewed together, you may have already had a predisposition, and you need to have good bacteria. And that means you're going to have to continue to work at trying to improve the profile of the bacteria in your gut with, I'm a type of person who's going to have to probably use herbs long term. I'm going to have to rotate herbs and, silver and things like that, just because I have a tendency to have more bad bacteria because my childhood was one with antibiotics and C-section, and I wasn't breastfed. So I didn't have a very good start. But I notice when I do have a better profile of bacteria in my gut, I do feel better. I do notice my moods are better. Okay. So stress is associated with leaky gut, and the impact on stress and leaky gut is likely to involve the gut and the brain. So there is this CRF, corticotrophin releasing factor, that plays a key role in the stress-induced leaky gut. In response to an acute stressor, there is actually paracellular permeability within the gut, the colon, and increases in this permeability have been associated with the development of visceral hypersensitivity, which is very interesting. So early life stress has also been demonstrated to impact in animals, and they've seen that they have more intestinal permeability and more bacterial translocation if they had stress as a child. So it's important to look back at your history to see what your childhood was like. A lot of my people that I've spoken with say that they had maybe divorce, or they may have had some abuse or some trauma that occurred as a child, and then as an adult, these things are all starting to become evident. So probiotics may induce positive changes to stress-induced HPA axis and autonomic nervous system dysregulation. So, I had said in one of my blogs that IC can be presented as autonomic nervous system dysfunction, ANS. And so there are some probiotics that may, as they're called psychobiotics, they may influence this in a positive way. They have been demonstrated to restore the tight junctions in the leaky gut, and also to influence the adhesion and translocation of the bacteria. So in response to stress, so they can actually reduce the impacts of that. Lactobacillus is one of them, amongst other things. I like the megaspore because it helps recondition the gut, so you can have a better profile of bacteria like lactobacillus. So there's L. helveticus and Bifido longum, or two that I mentioned. They can just restore the tight junctions. Now, here's an interesting thing I read. In a public speaking based stressor, so if you're having to public speak, it's very stressful, small intestinal permeability was significantly increased. But this was observed in subjects who also responded with an elevation of cortisol. That's going to be really interesting because I'm going to be doing a study with Megaspore, and we're going to be measuring secretory IgA and cortisol. So it'll be interesting to draw the connection between cortisol and gut immune properties or markers. So again, let me repeat that. Public speaking based stressor, they observed subjects who responded with significant of cortisol also showed more intestinal permeability. So if you're stress sensitive, if you're more likely to respond to stress with fluctuations in cortisol, you're also going to be more likely to have problems with leaky gut and the problems that arise with that. And so you can see upstream affecting downstream. Stressful early life events are also associated with depression later in life. And a dysfunctional intestinal barrier could permit a microbiota-driven pro-inflammatory state, and this can have implications for the brain. So the source of low-grade inflammation has been reported in depression, and it's not isolated to a particular source. So you can't necessarily isolate it to one source. But processes could engage the gut microbiota. So increases in leaky gut could lead to mucosal inflammation and an inflammatory response. Higher IgA-mediated immune responses can be directed against LPS. So you can have some issues with LPS and endotoxemia of certain gram-negative bacteria, and that they're actually seen in depressed people. So depressed people have more LPS. You can actually measure that. There's actually a lab that can measure your LPS levels. Through a company called Dunwoody. IBS is a stress-related functional brain-gut microbiota access disorder as well, and it's also associated with an altered gut microbiota profile and increased intestinal permeability. Let's see, systemic inflammation could increase intestinal permeability, and as a result of this inflammation, more bacteria can be translocated, and that increases more systemic inflammation. So here's a nice little image of neuroinflammation, and you can see what's happening here through this vagus nerve. It's disrupted barrier. You got stress, infections, antibiotics, poor diet. Microbiomes are here causing all these cytokines. This is the good side. This is the bad side. So you really want this side. You want prebiotics, probiotics, good diet. But if you have this side instead, you're going to have these problems with neuroinflammation. Okay, so see these are all metabolites of neurotransmitter. Tryptophan is a precursor to becomes kynurenine. So this is the serotonin pathway. So you can see that if this pathway is disrupted, you're going to have less serotonin available into the brain, and then you're going to have more depression. So it's all really, really interesting. IBS is a significant proportion of people with IBS also suffer from depression and anxiety, and these psychiatric symptoms increase with the greater frequency and severity of GI symptoms. So IBS is thought to be stress related. And it is a functional gut-brain microbiota axis disorder, and it's characterized by altered gut microbiota profile. So they actually see that with people with IBS, that their microbiota is altered. They also tend to have more leaky gut, and many of people with IBS also have depression and anxiety. So there you go. Another thing that's interesting is their firmicutes and Bacteroides ratio is altered, so they're a little bit higher. So what increases firmicutes is more of a meat-based diet. If you eat a lot of meat in your diet, you're going to have more firmicutes. And if you're more vegetarian-based and you have more vegetables and fruits and plant-based, you'll have more Bacteroides, and you really want a higher ratio of Bacteroides to Firmicutes because Bacteroides are more anti-inflammatory. And you can measure that in a stool test. GI infections can also produce elevated anxiety-like behavior, and antibiotics are responsible for altering the diversity and composition of the gut microbiome. So alterations in your brain circuits are involved in attention, emotion, and pain. So if you have problems with pain and emotions, this could be a whole vicious, wicked storm, perfect storm. And there's actually several pathogens that have been shown to have a detrimental effect on the intestinal barrier. So there's actually certain strains of bacteria, and I actually wrote a paper on this. So if you're interested, I can share that paper with you on the brain and the neurotransmitters and how they're associated. There's a bunch of different strains of bacteria in the gut that are associated actually with depression and anxiety. And there's serotonin. Serotonin is in your gut. So you have serotonin in your gut, but you also have it in your brain. But you can't always say that the measure that you find in the gut through urinary metabolites is going to be representative of what's in your brain. That's usually not the case, but it's always good to see anyway. So in the GI, it's responsible for secretion, sensing, and signaling. And then mucosal 5-HT, which is the precursor to serotonin, can play a direct role in the regulation of leaky gut. It can actually decrease leaky gut with redistribution of zonulin, which is why sometimes we recommend 5-HTP as a supplement for people who have leaky gut. It can decrease leaky gut, and it can redistribute zonulin. And gut microbiota play an important role in regulating this 5-HT synthesis and secretion. So you have to maintain a healthy intestinal barrier, and that's with diets rich in vegetables, fruits, and fish are associated with less depression, and that's because it improves the Bacteroides Firmicutes ratio. High-fat diets are associated with more LPS translocation. We talked about the lipopolysaccharide, which is the endotoxin of the gram-negative bacteria, and that translocation can go across the gut wall and contribute to systemic inflammation. So these foods down here are bad, and these up here are good. Meals rich in fiber, fruit can reduce the levels of fat and induce increased levels. Meals rich in fiber and fat can reduce the high fat induced increases in plasma LPS. So that means that if you eat a high fat diet and you have increased LPS, if you switch over to a high fiber diet, you can reduce that, and it'll help reduce inflammation and toll-like receptor expression. High fat diets increase firmicutes, which I just said, and fast food can also increase leaky gut and depression. All right. And you also can improve your barrier and the brain using probiotics. So the psychobiotics I just talked about, things like bifidolactis, lactobacillus rhamnosus, and lactobacillus plantarum. So they can positively shift leaky gut and reduce it. Lactic acid bacteria, like the lactobacillus, can reduce symptoms of IBS. That's documented in literature. You can read that for yourself if you just Google it, or you can ask me for my paper and I can send that to you. Prebiotics can alter gut microbiota. They can reduce low-grade inflammation, improve metabolic function, reduce leaky gut, and strengthen tight junction integrity, decrease plasma LPS and cytokine levels, and reduced hepatic expression of inflammatory and oxidative stress markers. So it's clear that certain strains demonstrate beneficial effects on the intestinal barrier across the lifespan through various mechanisms and mediators. So these are called psychobiotics, again, the probiotics, and they have been shown to be beneficial for mood, anxiety, and cognition. And I just wanted to share in a randomized single-blind placebo-controlled study, they used a fermented milk that contains Streptococcus thermophilus, Lactobacillus bulgarius, and Acidophilus, and Bifidolongum, and they noticed a decrease in small intestinal permeability through, although the large intestinal permeability was not really changed, but that's still pretty positive. So probiotics have been shown to influence the brain, neurochemistry, and behavior. And that's the end of that. Hopefully that wasn't too technical for you, but I know some of you technical geeks out there like to know all the details. So I put that together for those of you who are interested in the gut-brain axis. Thank you.